All right, this could be real fun today. Prior authorizations are not new to Medicare. If you were to believe the headlines, some news reports, some politicians, and even some insurance agents, you would think that the proposed prior authorization pilot program called WISER is introducing prior authorizations to original Medicare for the first time. Just look at these headlines from Kiplinger. Prior authorization coming to traditional Medicare starting in 2026. From Axios, traditional Medicare to add prior authorizations. From this news station, big changes coming to Medicare with some services moving to prior authorization in 2026. From Newsweek, Medicare update, major change sparks alarm from lawmakers. From McDonald and Hopkins, CMS to implement prior authorization models starting in 2026. From The Hill, HHS pilot program raises Democratic concerns over Medicare and red tape. Well, despite all the hubbub, Medicare has had prior authorizations for a long time, and some would say since its inception in 1965, 60 years ago. And today, we're going to talk about prior authorizations when it comes to Medicare, and hopefully we can all get a better understanding of exactly how good or bad prior authorizations actually are. I'm also going to show you what the odds are of you actually getting denied coverage due to a prior authorization on Medicare Advantage, and the answer may just surprise you. I'm going to let you know in what situation prior authorizations are the most annoying and potentially detrimental. I will let you know what kind of Medicare plan to pick if you want to reduce your odds of being denied coverage due to a prior authorization. And then at the end, I'm going to tell you how you can take a proactive role in reducing the likelihood that you will be denied coverage due to a prior authorization. Before I get started, if today is your birthday, a very happy birthday to you. Lucy Larkham said, "Whatever with the past has gone, the best always yet to come." This is not the first time I've addressed the prior authorization issue. I did a whole video on Medicare Advantage and prior authorization about a year ago, and I thought I was done. Plus, I've mentioned it numerous times on other videos as well. I wasn't intending on doing another video dedicated to prior authorizations, but given what is going on and some of the misinformation, I felt compelled to do so. So here we go. Part 1. Medicare prior authorizations have been around a long time. The Accreditation Council for Medical Affairs on their website, priorauthtraining.com, states prior authorizations actually originated from the use of utilization reviews in the 1960s. Utilization reviews started at the beginning of Medicare and Medicaid legislation. Their primary use was to verify an admission in the hospital, which verified the need for treatment based on a confirmed diagnosis by two doctors. Then in the 1970s, CMS began formalizing prospective reviews, including prior authorizations under the Professional Standards Review Organizations, established by Social Security amendments of 1972. Then in the 80s and the 90s, prior authorizations expanded beyond hospitalizations to include outpatient services, durable medical equipment, and certain high-cost procedures. In the 2000s and beyond, CMS launched demonstration projects testing prior authorization like power mobility devices, i.e. power wheelchairs. CMS expanded prior authorization demonstration programs to include repetitive, scheduled, non-emergency ambulance transports and home health services in certain states. These were implemented in response to high rates of improper payments and fraud in those categories. And since 2020, there's been a list of outpatient department services that require prior authorizations. Part 2. What purpose do prior authorizations actually serve? Prior authorizations are a tool employed by Medicare or an insurance company, in this case a Medicare Advantage company, to prevent primarily three things. 1. Unnecessary treatment at the expense of Medicare, which is your tax dollars, or the Medicare Advantage company, which is also your tax dollars. 2. To prevent a treatment or medication from potentially causing harm to the patient. And 3. Fraud from unethical providers seeking to build Medicare or the Medicare Advantage company out of money. If you don't think that happens and it's not a problem, well, it is. If you don't believe that provider fraud is an issue, just look at these cases. National healthcare fraud takedown results in 324 defendants charged in connection with over $14.6 billion in alleged fraud. Durable medical equipment owner sentenced to 12 years for $61 million Medicare fraud scheme. And get a load of these. Esther N. Mbaya, age 43, of Harrisburg, pleaded guilty and was later sentenced on February 27th of 2025 to 41 months in prison in order to pay $3,349,550 in restitutions on charges of healthcare fraud and bank fraud. Then we have Florentina Mako, age 39, of Cambria County, was sentenced on December 14, 2023 to 30 months in prison in order to pay $1,408,976.48 in restitution. She pleaded guilty on June 16, 2023 to defrauding Medicare by submitting medically unnecessary urine drug tests for chronic opioid patients at medical clinics where she was the chief executive officer. I trust we all get the point. The government and private insurance companies are constantly fighting off fraudulent claims, and we should all be in favor of Medicare and private insurance companies having systems in place to prevent what is known as fraud, waste, and abuse. But the question is, are prior authorizations part of the solution? And how effective are they in helping? We shall see as we continue. Here's what CMS states. CMS runs a variety of programs that support efforts to safeguard beneficiaries' access to medically necessary items and services while reducing improper medical billing and payments. Through prior authorizations and pre-claim review initiatives, CMS helps ensure compliance with Medicare rules. Part 3. What are the odds of getting a prior authorization with Medicare Advantage? According to the Kaiser Family Foundation, Medicare Advantage insurers made nearly 50 million prior authorization determinations in 2023, reflecting steady year-over-year increases since 2021 and 2022 as the number of people enrolled in Medicare Advantage has grown. In 2023, there were nearly 2 prior authorization determinations on average per Medicare Advantage enrollee, similar to the amount in 2019. In 2023, insurers fully or partially denied 3.2 million prior authorization requests, which is a somewhat smaller share, 6.4% of all the requests in 2022, 7.4%. Though a small share of prior authorization denials were appealed to Medicare Advantage insurers, most appeals, 81.7%, were partially or fully overturned in 2023. So, if all 3.2 million denied requests were appealed, and 81.7% of them got partially or fully overturned, then in reality, only 585,000 prior authorizations would have been fully or partially denied, or 1.7% of all prior authorizations. The Kaiser Family Foundation also states, prior authorization requirements are intended to ensure that healthcare services are medically necessary by requiring approval before a service or benefit will be covered. Medicare Advantage insurers typically use prior authorization along with other tools such as provider networks to manage utilization and lower costs. This may contribute to their ability to offer extra benefits and reduce cost sharing, typically for no additional premium, while maintaining strong financial performance. At the same time, prior authorization processes and requirements, including the use of artificial intelligence to review requests, may result in administrative hassles for providers, delays for patients in receiving necessary care, and in some instances, denials of medically necessary services, such as post-acute care. Part 4, do prior authorizations actually help reduce unnecessary treatments and reduce costs? Well, there are certainly plenty of cases, and many documented, that a prior authorization either avoided fraud from a medical provider or patient, thus saving the system money. And there are plenty of cases, and many documented, that a prior authorization prevented unnecessary treatment that would have harmed the patient. If you doubt this, check out the book, The Price We Pay by Johns Hopkins Dr. Marty Makary. I couldn't believe all the unethical and unnecessary treatments some providers do. But what about overall, the big picture, as they say? Since I don't know the answer to that question, let's ask multiple AI agents and see if we can get a consensus. ChatGPT. While prior authorizations were introduced with the intent to control costs and ensure appropriate care, their current application often leads to delayed treatments, increased administrative burdens, and potential harm to patients. The evidence suggests that the negative impacts on patient care and healthcare efficiency may outweigh the intended benefits. Reform efforts are underway, with some insurers pledging to reduce prior authorization requirements and streamline processes to alleviate these issues. What about Claude? My assessment, based on the available evidence, prior authorization appears to be broadly problematic for the healthcare system. The original 1960s era promise of controlling costs while maintaining quality has largely failed to materialize. Instead, we see, for patients, delayed care, increased costs through additional visits, and barriers to appropriate treatment access. For the providers, massive administrative burden, frustration with the process, and time diverted from patient care. For the healthcare system, administrative costs that likely exceed any savings and perverse incentives that may actually increase overall spending. The fundamental issue is that prior authorization operates on the assumption that physicians routinely prescribe unnecessary treatments, but this assumption lacks strong empirical support. While the documented harms, delayed care, administrative burden, and increased costs are substantial and well documented. A more effective approach would likely focus on improving physician decision supporting tools, addressing the root causes of healthcare cost growth, and developing value-based payment models that align incentives rather than creating adversarial gatekeeping systems. And lastly, what about Grok? My opinion on prior authorizations, says Grok. Broadly, I think prior authorizations are bad for patients, providers, and the healthcare system, though they have some redeeming qualities that could be salvaged with major reforms. For patients, the harms are delays, treatment abandonment, and adverse events. Far outweigh benefits like preventing misuse, as evidenced by AMA surveys and studies showing life-threatening outcomes. This is especially true for vulnerable groups in Medicaid or with chronic conditions where barriers exacerbate inequities. What I can tell you is, from what I've seen, the place for prior authorizations have been detrimental is in skilled nursing and post-acute care. I have had numerous clients that have done very well on Medicare Advantage until they went into the skilled nursing center. And even though they're covered for up to 100 days, what happens is if they are not progressing, if they are not getting better, then the insurance company says, you don't need to be there or we're not going to pay for you to be there. Despite what the people at the skilled nursing center might say, despite what their provider might say. And yes, those people can appeal it, but that usually only buys them a day or two. Okay, part 5. Is this all part of a grand scheme to get people to accept Medicare Advantage? Well, Deft Research has posed that question. In their article, Prior Authorizations Coming to Traditional Medicare, a Conversion Opportunity for Medicare Advantage, they write, Medicare beneficiaries will likely not receive these changes well. As Deft has shown most recently in the 2025 Medicare Age-in Study, in addition to a wide network system, one of the main reasons seniors choose to keep Medicare A and B only, with or without a Medigap plan, is not having to worry about availability of care, essentially avoiding managed care. They go on, if Medicare Advantage carriers can focus marketing on what supplemental benefits traditional Medicare beneficiaries would gain with an MA plan and de-emphasize their own prior authorization authorizations, they have a chance to convert customers, especially if carriers highlight how this experimental rollout has a potential to lead to additional services requiring prior authorizations for Medicare A and B in the future. And while Medigap plans cover the additional costs from traditional Medicare, they will also be subject to these new prior authorizations. Agents who typically steer, which you're not supposed to do, clients away from Medicare Advantage due to their aversion to prior authorizations may want to change their tactic. Be careful of agents changing their tactic. In the end, seniors may benefit most by being placed in a private Medicare plan. But we shall see. And they go on. If fee-for-service Medicare becomes increasingly managed, it might make Medicare Advantage more appealing to those who have been resistant in the past. Part 6, Conclusions and Solutions. I hope you understand that all this talk and news about Medicare suddenly having prior authorizations is truly blown out of proportion, and in most cases is not going to affect that many people. I personally don't think prior authorizations are going anywhere. I think the need to and desire to truly cut unnecessary treatment is important to the healthcare system overall. The question is how, and how to make sure that it's fair. Perhaps AI is part of the solution. Only time will tell. To me, a simple solution is if a patient or provider can get a validating second opinion from another non-affiliated provider, then the prior authorization should be approved. In the end, the best thing is to get in the best shape and health as you can and hopefully avoid any sort of medical situation that demands a prior authorization. If you want to decrease your chances of being denied coverage, then stick with original Medicare and get a supplement. I'd love to know your thoughts. Please comment, but please keep it clean and non-offensive. If you have questions about what I've just gone over and when you are ready for my help in maximizing your healthcare and retirement insurance coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, which you can see right here, then please, by all means, feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about your healthcare needs and philosophies and budget, and I will do my best to answer any questions or concerns that you may have. Once we determine what is best for your unique needs and budget, I will then enroll you in the plan or the plans of your choice, and of course, be available down the road for your support. To stay up to date, especially on things like this, and gain more insight on maximizing your Medicare insurance and perhaps your health, then please go ahead and subscribe. And who do you know who may benefit from this info? Please share it with them. I'm Chris Prang, the Medicare analyst. Make it a great day.